Well, I'm here today and I'm really excited because I'm talking to Dr. Julius Few, who's a plastic surgeon based in Chicago. And we're going to have a bit of a talk about the combination of non-surgical and surgical modalities for body contouring.
It's a topic that I love to talk about.
Yeah.
I'm happy to be here.
Great. So tell us a bit about it. So how did the two work together? Like, it's not, you don't just have, because I've had some body contouring procedures after losing a lot of weight. So, and I've actually done both the non-surgical and the surgical. So how do they work together? Why would one have both?
Well, as you know, having body contouring surgery can, for a lot of the patients who we see, it can be a real challenge because the surgery comes with downtime, the risk that maybe some of our patients don't want to take, and a lot of patients actually will come in saying they just don't want to have surgery, or if they're going to have surgery, they want it to be the bare minimum in terms of risk and recovery and all of the other kind of details that go with surgery. So the way that I've kind of evolved over the last 15 years or more has really been kind of a progressive journey that I've had with my patients who basically have been very loyal and working and following with me. And so, for example, patients who I started by doing a abdominoplasty or tummy tuck, they got a good result. But as we know, I mean, for all of us, I mean, our weight goes up and down, life fluctuates, and this is reality. And so I will have people who come back with a little bit of fat pooching out somewhere that they don't like, but they ask, can we do something other than surgery? And now as the technology has continued to get better and better, the reality is we can use the different modalities like cryolipolysis or focused heat or a combination of both to really get, I think, a nice enhancement to what already would have been a good surgical result.
Yeah, because I think the days are gone of you going to your plastic surgery, having a treatment, and then disappearing. Now we form that relationship and you go to have, well, pretty much everything done. You find who you align with and then you go there and you have little tweaks here and there. And so that's exactly what I've done. I had an abdominoplasty, then I had a bit of lipo, then I had a bit of sculpture on the side, and just to sort of get that...
The hybrid.
Yeah, because it's never going to be perfect, and I am a fluctuator. Yeah,
and this is the best of all worlds. I mean, the truth is that you want to have a relationship with the provider who has a good artistic eye, but also has the ability to say, yes, this is a good choice for you, or it's not a good choice for you, and then to build the relationship that way. And the analogy that I like to use is it's a lot like your house or your home. I mean, it would be foolish to think once you buy or rent your home, you will never think about doing anything to it ever again.
Exactly.
That's not real.
No.
And so the truth is that as we put everything together, I mean, overall, that's the idea. It's maintenance and protecting your investment. So in many cases, especially for body contouring, if you have someone who's maybe even done liposuction, but and I get this all the time, I have patients who say, you know what, I'm going to have, and they can be relatively young, and they'll say, well, I'm really worried that after I have liposuction, I'm going to have loose skin. Well, we now have a protocol where once a year, we'll do radiofrequency tightening treatments to stimulate collagen, to keep the tissue tight, and it maintains their liposuction results. So the days of coming in and going are gone.
No, it's all about maintenance and a certain level of, maintaining
and protecting
that
your investment. And the truth is, in an application that has real benefit over time, it makes sense. Instead of 5-10 years later going back and saying, oh, I'm going to have liposuction again.
Or I'm not happy with my result.
I'm not happy with the skin or something of that.
No, that's great. Oh, well, good to hear, because I'm very much of that philosophy, so it's really good that that's actually what everyone's putting out there as well.
Absolutely.
Awesome. Well, thank you so much for that.
Nice to
thank
meet
you.
Yeah.
So if you're having a procedure, or if you've got a doctor that you've got, try and make sure that they have a nice aftercare as well. Although that's a good thing about being in Australia, you'll always get aftercare with your practitioner. So any information, just drop us an email at help@plasticsurgeryhelp.com.au. Thank you so much.
Thank you.